as an innovative approach for investment in the future of healthcare in Egypt. My agenda for this presentation: introduction, significance of the study, aim of the study, research, hypothesis, subjects and methods, results, conclusion, and recommendations. Introduction: artificial intelligence is receiving a lot of attention from investors, the press, and the lab forces across all industries. While artificial intelligence has already achieved widespread adoption in specific sectors, the complexities of healthcare have resulted in slower adoption. Artificial intelligence is becoming popular in as many. Sorry, I want to put something because I can't see the picture. Artificial intelligence is becoming popular in many healthcare sectors. There is a paradigm shift to digitalize healthcare sectors to get competitive advantage in the labor market. Artificial intelligence has managed to capture the attention of key healthcare stakeholders who are now in a dilemma of whether or not to integrate it fully or partially in their business. Many countries have prioritized artificial intelligence development by investing billions of dollars into artificial intelligence industrial hubs. Other nations and global corporations have also invested in artificial intelligence programming and the creation of innovative artificial intelligence applications. Based on this trend, many organizations are nowadays increasingly focused their attention on investing in healthcare industry by using artificial intelligence. Artificial intelligence is being used to improve efficiency in the delivery of healthcare by extending healthcare workforce capacities to counteract labor shortages, minimize the cost, and maximize the quality of care. Significance of my study: in a time of rapid healthcare transformation, health organizations must quickly adapt to evolving technologies, regulations, and consumer demands. Artificial intelligence offers the industry incredible potential to learn from past experiences and make better decisions for the future. Artificial intelligence can assess the proactive patient care, reduce future risk, and streamline work process. The emerging use cases of artificial intelligence in healthcare sector can be seen as a collection of technologies enabling machines to sense, comprehend, act, and learn so they can perform administrative and clinical healthcare functions, as well as be used in research and for training purposes. Over the past several years, artificial intelligence has multiplied productivity across a range of human endeavors, and its widespread adoption into everyday life is accelerating at a rapid pace. The aim of my study was to investigate perception of managers and patients about artificial intelligence application in the healthcare domain in Egypt through assess managers' knowledge about artificial intelligence in the selected hospitals, increase managers' awareness about artificial intelligence, assess the application of artificial intelligence in healthcare as perceived by nurse managers and medical managers in the selected hospitals, identify patients' perceptions of the application of artificial intelligence in the selected hospitals. The research hypothesis was hypothesized that nurse and medical managers lack knowledge about artificial intelligence. Also, managers and patients will perceive artificial intelligence negatively. subjects, and methods. The research design which I used in my research was it's a quasi-experimental study. The study was conducted in Ain Shams Specialized Hospital. It's a university hospital. The second hospital was Dar al-Shifa Hospital in Cairo. It's a therapeutic institution in Cairo under the Ministry of Health. And the last one was Dar al-Fuad Hospital. It's a private hospital. Subjects, the first group was managers, all management levels of nurses and medical staff, top management level, middle level, and functional management, or the first line managers. All available managers with at least 2 years experiences were included in the study. They were 165 managers. As you see here in this table, the distribution of study managers according to hospitals, they were 165. They are classified as you see in this table. The nurse managers were 92, classified in the three management levels, top level, middle level, and the first line managers. Medical managers, they were 73, also classified in the three management levels, top level, middle level, and first line managers in the three different hospitals, as I mentioned. The second group was patient. The second group was comprised of 300 patients randomly selected from wards and critical care units. In the selected hospital, this sample included alert and oriented male and female patients with different diagnoses. 3 tools were used for data collection in this study. The first one was managers' knowledge about artificial intelligence. It's a self-administered questionnaire developed by the researcher, used to assess selected managers' knowledge about artificial intelligence, as its definition, benefits, risk, and so on. The second tool was managers' perception about artificial intelligence. It's also a self-administered questionnaire and developed by the researcher too, to assess nurse and medical managers' perception about application of artificial intelligence in nursing and in medicine. The last one was patient perception about the application of artificial intelligence in healthcare, to assess their perception about the application of artificial intelligence in healthcare in Egypt. The pilot study was conducted in this study to test the practicability and to estimate the time required to complete the tools. It was conducted on 10% of the total study samples. The collection of pilot study data lasts for 1 month. All of these subjects were excluded from the primary study sample. Necessary modifications were done in the study tools according to the pilot study results. Then, regarding the administrative and ethical considerations to carry out the study in the predetermined hospitals, letters containing the aim of the study were directed from the researchers' faculty of nursing to hospital directors to obtain their permission and help to conduct the study in their facility. The researcher met them and explained to them the purpose of the study and the process of data collection, and obtained the study subjects' approval orally. Confidentiality, anonymity, and the right to withdraw from the study at any time were granted. The main results of this study revealed that, as you see here in this table shows percentage distribution of managers' knowledge about artificial intelligence before and after awareness session. This table included many knowledge as definition of artificial intelligence, benefits of artificial intelligence, kinds of artificial intelligence, segments of artificial intelligence in healthcare, opportunities for artificial intelligence in healthcare, risks for artificial intelligence in healthcare. As you see in this table, the right part, hospitals before managers' knowledge in the 3 hospitals before awareness sessions, while the other part, the manager's knowledge post-awareness session. As you see here, that most of nurse managers lack of knowledge before awareness sessions in all of the items of about artificial intelligence, while post-awareness sessions, most of them have adequate knowledge regarding all the items of artificial intelligence. As you see here, this is in this figure. This figure shows the nurse manager's perception about the application of artificial intelligence. Most of the study samples agreed upon most of the items regarding the application of artificial intelligence in nursing. Those items included, for example, artificial intelligence will not replace nurses. Artificial intelligence can give nurses more time with patients. Artificial intelligence helps nurses to increase efficiency and make more informed decisions for their patients. Artificial intelligence helps nursing staff in making their daily to-do lists. Artificial intelligence improves the quality of nursing care, which will in turn increase patient safety and satisfaction. Nurses will eventually become higher level delegator. Artificial intelligence will introduce a new nursing rule, which to ensure the patient's quality of care through collaboration with healthcare workers using updated technologies. Also, artificial intelligence will help the nurse to improve nurse-patient relationship, because the relationship will extend beyond the hospital boundaries. The new generation of nurses highly uses technology in their life, so they will be motivated to work within a technology-enabled environment. Also, the virtual simulation could support the training phase of nurses, as nursing care can use can use it for many things, as in medication management and disinfection, lifting bedridden patients, all tasks that robot could support. All of them, about 16 items. Most of the study subjects or nurse managers agreed upon them. As you see here in this figure, medical managers' perceptions about the application of artificial intelligence in medicine. Most of the study subjects or the medical managers agreed upon all of those items, as it will be difficult to totally replace doctors' consultation with digital tools, because digitals can't imitate doctors' nonverbal communication. Doctor's judgment is a vital part of clinical activity and essence of being a doctor. Lay people are unfamiliar with medical terminology, which in turn can feed them to risk of misunderstanding and estimate how much the situation is critical. Artificial intelligence reduces the trust and quality of the doctor-patient relationship. If there is a contrast between doctors and artificial intelligence opinion, which will be considered right? And other items, they were 11 items. As you see here in this figure shows patient perception about the application of artificial intelligence in healthcare. As you see here, that most of the items, approximately they are equal, they agreed upon them. Those items included: machines mean no emotions, not get tired, and fast decisions, not as human beings or as humans. Doctor judgment is a vital part of clinical activity and the essence of being a doctor. Artificial intelligence helps in offering an unified patient care. Artificial intelligence as telemedicine provide patients consultation all over the day and anywhere. Unsafe artificial intelligence could harm patients in the healthcare system by using misleading algorithms. And other items, they were 13 items. This also continuing those those items regarding the patient's perception about the application of artificial intelligence in healthcare in Egypt. As you see also, most of them are equal, approximately are equal and agreed upon them. Finally, my conclusion for this research was there was a highly significant difference between nurses' managers' knowledge about artificial intelligence before and after awareness sessions conducted by the researcher. The majority of nurse and medical managers perceived application of artificial intelligence positively in nursing and medicine. Also, patients viewed the application of artificial intelligence in healthcare positively. My recommendations for this research, which were based on the study findings, were the following. Restructuring of nursing and medical curricula to introduce artificial intelligence concept in healthcare. Development and adoption of new staffing and training strategies to use technology in healthcare. Utilization of high-performing and reliable network capabilities to fit using artificial intelligence. Provision of access to high-quality, unbiased data sets critical to the success of artificial intelligence in healthcare. Preparation of ethical standards to safeguard the patient's information. Find balance between the cost of application of artificial intelligence in healthcare and its potential benefits. Identification and sharing of best practices and foundational principles of artificial intelligence policy regulations in healthcare in Egypt. Creation of mechanisms to support the adoption of best practice artificial intelligence regulations and policy within healthcare settings in Egypt. Re-engineering of some of the Egyptian hospitals in different sectors to use artificial intelligence. Establish a research focus on artificial intelligence in healthcare in Egypt in different settings, and to provide more rigorous results. Strengthen a perspective theory about artificial intelligence in healthcare in the search for gaining sustainable competitive advantage for Egyptian hospitals. Finally, this is the summary of my presentation. I hope it was very simple and very clear. Thank you for your attentive listening and for giving me this chance. If you have any question, I'm ready. Thank you very much.